Okay, well, I'd like to welcome you to the November seminar for the Western Center for Agricultural Health and Safety. We're really pleased to have you here today. I'm going to go through just a couple of introduction slides and then pass it on to our esteemed presenter. As background information, this seminar is being recorded. All participants are muted. If you do have questions during the presentation, please enter them into the chat function and we will collect them for a question and answer period at the end of the presentation. Spanish interpretation is available for this presentation. If you would like to use Spanish, please select the Spanish language in your selection down in the interpretation button down below on the menu. And if you have any questions about that, you can put them into the chat and we'll be happy to help facilitate you. Okay, so today I'm really pleased to introduce Dr. McCurdy, who is a longtime member of the Western Center for Ag Health and Safety. He is going to present today on valley fever among California farm workers, though he has a long research record on farm worker health and safety, sexual harassment prevention among farm workers, and we're really pleased to have you. So thank you so much, Dr. McCurdy. The floor is yours.
Thank you, Heather. I want to thank everybody at the center there for the invitation to come and speak today. I think often and fondly back at my time on the faculty there at UC Davis, especially within the Ag Center, which was really a major part of my coming of age, as it were, on faculty. And so it's great to have the opportunity to be back and talk a little bit about some of the research that we were completing as I was coming into retirement and have continued to work on since then. So with that, let me move on from my title slide to the next slide. What I'm going to be talking about in brief here is a little bit on the ecology and life cycle of the organism that is involved in coccidioidomycosis, some of its clinical features and recent history, a review of California epidemiology, and then about our UCD study, coccidioidomycosis in California Hispanic farm workers. We'll go through the demographics, occupational exposures, and the conclusions that arose from this, and talk a little bit about the strengths and limitations, and finally where I think this work ought to lead. So with that, let me go to the next slide. So coccidioidomycosis, please excuse it, it is practically an unpronounceable word to the new initiate. It is a fungal disease first described in Argentina by Alejandro Posadas back in 1892. At that point, it was not understood to be a fungal disease, of course. In the US, its knowledge about it dates back to the earlier part of the last century. And it was first described, or some of its earlier descriptions were in the San Joaquin Valley, and hence it was known as San Joaquin Valley fever, which is often shortened, of course, to valley fever. Sometimes it was known as desert fever. But the two names that you're probably going to be working with mostly are coccidioidomycosis and valley fever. So it is endemic in dry and hot regions of the southwestern US, that is the lower Sonoran life zone, not just in North America, but also in South America. And the agents are Coccidioides immitis, and that is the strain that is most typical in California. And outside of California, it is Coccidioides posadasii. About 97% of US cases are in California and Arizona. However, in recent years, we've seen coccidioidomycosis arising and in areas that are very surprising to us, as far north, for example, as Washington State. So here are the areas where it is typically found. You'll note that Washington State is not included in that, so an updated map should show some prevalence of it up as far north as Washington. So in the desert, the fungus makes a spore in hot and dry conditions, and it can outlast other competitors. And being a fungus, when it rains, it grows, and when the soil dries again, these spores can become airborne, especially in windy conditions, as we'll see. So this graphic in the next slide shows the basic biology of coccidioidomycosis, it is considered a dimorphic fungus. So in the upper left there, we see hyphae. So a click will bring out the word hyphae there. And we can see that it's basically a long chain of spores. As that dries out and the wind blows, another click will show that the arthroconidia become airborne and are easily inspired. And once in the lung, another click shows the spherule, and that is filled with literally tens of thousands of these spores. So coccidioidomycosis is first and foremost a pulmonary disease, but it can have systemic manifestations. So in my next slide, just very briefly, we'll talk about the clinical features. It is not communicable, so someone with cocci in general cannot give it to someone else. Most of the times it's fairly mild, roughly 60%, 2/3 perhaps, of people who contract valley fever are asymptomatic, and the remainder are generally have mild symptoms. It can cause a benign pneumonitis, and therapy is not required for this. It can cause an actual pneumonia, and again, this is usually self-limited. And then it can cause dissemination, that is, it can get into the bloodstream and seed various other organs, skins, bones, joints, etc. And that is very bad news. I have down here less than 5%. I mean, it may be about 1%. It's very difficult to know because the fact that the disease is so mild in many cases, we don't have a true idea of what the denominator population is. But certainly in a minority of cases, we'll see dissemination. In the next slide, I want to introduce some recent history, and that statue is of Clio, who is the Greek muse of history. So have a look at this. That looks extremely ominous in the next slide here. What we see is the results of a dust storm that occurred almost exactly 43 years ago, almost to the day here. 5,000 foot of elevation. And the windstorm, this was down near Bakersfield, actually down near the town of Arvin, which is a little south of Bakersfield. That dust storm raised that dust, which contained spores of Coccidioides immitis, took it as far north as well north of Sacramento. So it had impact in terms of an increase in valley fever cases, to Sacramento and beyond. It was first reported by our very own Dr. Papagiannis in the Western Journal of Medicine, and he used the wonderfully alliterative title of "Tempest from Tehachapi Takes Toll." Very creative. My hat's off to you, Dr. Papagiannis. In the Sacramento County, there were at least 115 cases where normal is fewer than 6, and there were at least 6 attributable deaths to this. And this was published in the New England Journal by UC Davis's Dr. Neil Flynn back in '79. So this event was ranked 9th in the top 15 of California environmental disasters of the 20th century. So if we go to the next slide, we can see a map from Dr. Flynn's New England Journal of Medicine publication there, showing down from Bakersfield, that arrow shows the dust up to as far north as Marysville. And if we go to the next slide, we can see what happened for all of California. So we can see the pre-windstorm average over the past 10 years of the number of cocci cases through time, by week through the year. And we can see that it's somewhere between 300 and 500 per week. That top dotted line, that top dotted line with another click is the post-windstorm values. So you can see we went up from about 400 on average up to 1,100 cases. So probably at least a 3-fold increase in cases. So really quite amazing. In the next slide, we can see the result of the Northridge Earthquake, which occurred in January of 1994, in that there was a whole lot of moving and shaking going on, and it caused landslides throughout in various parts of the state, including the Santa Susana Mountains. And those landslides brought up into the air huge amounts of dust, which were laden with coccidioidos spores. So in that local area in Ventura County, there were 203 cases of coccidioidomycosis within 7 weeks. Over half of them were hospitalized with a mean length of stay of for about a week. And in a little less than 4%, there was dissemination, and there were 3 deaths. So this is serious business, and it can come and get you even when you're not expecting it from far away. So this is a brief review of current valley fever epidemiology. So as the next slide will show when we get to it, we've only been seeing increases in the last several years. So 2019 is the highest year on record with over 9,000 cases. And that is the highest that has been seen since reporting began in 1995. So the incidence statewide is about 23 cases per 100,000 population per year. But look at that, it's over 15 times increased in Kern County, California. Kern County is really the hot spot for coccidioidomycosis in California. So the cases tend to peak in the fall, around October, and risk factors include being a working age adult, particularly in 40s and older. Male sex, men are roughly at 2-fold increased risk compared to women. Having Black, Hispanic, or Filipino ancestry, pregnancy, and various common comorbidities, diabetes, immune compromise, and certainly outdoor work, including agriculture and soil disruption, anything that involves soil disruption, which can bring which can aerosolize the spores. Anything of that nature is going to increase risk. So in the next slide, we can see a recent bar graph showing the number of cases since 2001 in California. And you can see since 2014, it's pretty much done nothing but go up. It looks like 2018 was just a little bit smaller or had a lower number than 2017, but it certainly made up for it in 2019. So I want to give a shout out to my colleague, Gail Sundermeyer-Cooksey, who just recently, like Friday, has a publication in the MMWR about a regional analysis of what's going on in California with coccidioidomycosis. So it's hot off the presses. So you can see in the next slide on the left, a map of California counties. So again, in California, the overall incidence rate there is 23 per 10 to the 5th per year. In Kern, it's roughly 15 times that. So Kern County and the surrounding counties are really where the action is as far as valley fever goes. In the next slide, continuing with its current epidemiology, we see that agricultural work is a recognized risk factor. In California agriculture, Hispanic persons predominate very strongly. So for seasonal and production agriculture, probably over 90, even 95% of hired workers are of Hispanic origin. And that group is at increased risk for severe disease. So in contemplating all this back in 2014, I guess it was, we identified several knowledge gap areas. One dealt with the population's knowledge, attitudes, beliefs, and behaviors regarding coccidioidomycosis. And this is very important when we're trying to craft preventive health messages. A second area was identification of high-risk crops and tasks. So as we looked through the literature, there was general, and early on recognition that agriculture was a risk factor. Working in agriculture was a risk factor, but there had been no prior work trying to tease out whether any particular work with specific crops or tasks carried increased risk. And then thirdly, working with Kent and others, Keith, we wanted to see if we could identify infectious spores in ambient air. So these infectious spores had been identified in the earth, in the ground, in various locations, particularly in Kern County and elsewhere, but they hadn't actually been found in air. So one of the things we considered doing was some air sampling for this. So with this, we put in a proposal to NIOSH and CDC to look at coccidioidomycosis in California Hispanic farm workers. Fortunately, it was funded and we embarked on the study. So although we were there in UC Davis at the Western Center, as the slide shows, the work actually itself was down in Kern County because it is, as I indicated, the hotspot for valley fever in California. So in the next slide, I'd like to talk a little bit about the specific aims for this work. So the first specific aim was a survey of current Hispanic migrant farm workers at some migrant housing centers in Kern County, California. So this survey was a cross-sectional study and it addressed the levels of knowledge, attitudes, beliefs, and behaviors among the population there, which consists of basically seasonal migrant farm workers for the later development of educational and preventive programs. So where this stands right now with another click, we have a manuscript in preparation, and with another click, I will indicate the basic findings at this point. So roughly 3/4 of the population were aware of valley fever, its basic features, the role of dust exposure.
De lo que es la fiebre del valle, una básica entendimiento de cómo podían ser expuestos, pero sí habían unas faltas de concepción. Había un gran entendimiento de que los pesticidas tenían un rol grande y que podrían transmitirse por la comida, por el agua. Y la creencia de que los paños les protegen de eso. Sí, los paños pueden protegerte un poquito a cierto nivel, pero no 100%. No es un alto nivel de protección los paños que usan para cubrirse la cara. Lo que en términos de lo que causa la fiebre del valle y cómo identificaban la fiebre del valle con la educación de los pesticidas, es porque se ha hecho más alcance sobre los pesticidas. Es mi creencia de que por eso es que se conflictaba la información con la fiebre del valle. También la comida y el agua no son involucradas en la transmisión, así es que es muy importante identificar el nivel de conocimiento y también cualquier falta de concepción, porque si las personas están tomando decisiones basado en información incorrecta sobre cómo se transmite la enfermedad, entonces no va a ser tan efectivo. La otra cosa que incluimos aquí es un asesoramiento de dónde es que está obteniendo la comunidad la información, quiénes son sus recursos de confianza, si es para que de esa manera los consideremos cuando estamos desarrollando esta información importante. Y podemos ver que muchas personas, su primer entendimiento de haber aprendido sobre la fiebre del valle ocurrió cuando un familiar o alguien cercano les pegó la fiebre del valle. Así es que eso es la meta específica número 1. Y sí estamos colaborando, por ejemplo, con el doctor Tales de UC Merced. Y lo segundo, una de las segundas metas es un estudio de casos de control donde evaluamos a 200 personas en Kern Health posiblemente con fiebre del valle, y la razón por esto era para identificar y caracterizar la demográfica y los riesgos ocupacionales, particularmente poniendo atención en el tipo de cultivo y el tipo de trabajo, cómo eran estos asociados al riesgo, y evaluar cómo las personas que decían que estaban trabajando muy frecuentemente en situaciones más expuestas al polvo, que cómo es que podíamos evaluar que ellos tenían un riesgo más alto de ser expuestos a contraer. Así es que el estatus basado en lo publicado que apenas salió en julio en el CDC de enfermedades infecciosas emergiendo. Así es que aquí podemos ver a nuestros coautores. Tenemos a Portillo Silva, a Sippenbang y a Emery. El estudio diseñado es un estudio central sobre un ejemplar denso, y esto quiere decir que mientras que los casos siguen desarrollando a través del tiempo, los tomamos y tomamos un control temporáneo para que de esa manera estemos recolectando casos a través del tiempo. Y por causa de varios sistemas de diseño, parece ser que esto es una de las mejores maneras de hacer un estudio, es recolectar casos a través del tiempo y conectarlos con el caso. La población de meta eran trabajadores adultos de hispanos, trabajadores del campo, y ellos eran referidos para la identificación de coccidioidomycosis en el Departamento de Salud Pública de Kern County. En el siguiente identificamos casos donde las personas eran referidas para examinación y entonces eran identificados para esporas infecciosas. Típicamente se les la inmunodifusión IgG o inmunodifusión IgM, y en estos casos nosotros considerábamos si alguno de los tres casos, incluyendo la reacción complementaria, era negativa, entonces nosotros tomábamos la información para ver el por qué. En junio del 2016 hasta agosto del 2018 hubieron como 3,509 personas referidas a lo que era el laboratorio público de salud de Kern County para ser examinados, que por lo cierto tiene un historial fuerte de recursos clínicos para lo que es la fiebre del valle. Así es que ellos estaban siendo vistos allí y eran considerados como tener una clínica que examinaba. Y de estos hicimos una entrevista telefónica con más o menos unos 1,800 de ellos, y todos los que eran positivos hablábamos con ellos, y una pequeña fracción de los que eran negativos al azar. Y entonces terminamos con una cantidad por igual en los controles. Así es que en las entrevistas por teléfono identificamos si eran hispanos, si habían estado trabajando en Kern County o en la agricultura en el último año, y si podían darnos el consentimiento para hablar con ellos, y si hablaban inglés o español. Y al final del día teníamos como 380 personas elegibles, y de ellos 215 estuvieron de acuerdo con a llevar a cabo la entrevista. Así es que como un 57% en sí, y por lo cierto la participación era más alta en la situación de los casos. Yo creo que era como en las situaciones de control eran como un 40% de los casos. Eran de los 203 casos, mantuvimos como 110 casos y 93 controlados, y los incluimos en la examinación final. Ahora aquí en esta diapositiva vamos a compartir algo de esa data. Ahora queríamos también comparar cómo los informes y controles son comparativos uno con el otro. Pensamos que tal vez iban a ser algo similares. No fue así como estamos mirando así. Así es que aquí podemos ver que los hombres eran más predominantes a contraer a un 58% en casos versus un 64% en controles, y similarmente habían diferencias también en las edades. En esta parte inferior podemos ver que el grupo más grande en los controles y también estaban en los controles allí con las mujeres. Así es que entre sí, las estadísticas eran muy similares. Así es que ya estamos observando el hecho de que sí hay una diferencia entre el sexo y la edad en términos de la consistencia versus las estadísticas de control. El país de nacimiento, como 3/4 eran nacidos en México, y el lenguaje de la entrevista, yo creo que como un 80%, si no es que un 90% fueron casos en español. Y de residentes de los Estados Unidos eran como entre 2 décadas, y la mayoría de ellos en el condado de Kern. Así es que esto es una población estable de ya buen tiempo, y ninguno de esas diferencias fueron estadísticamente significantes. De acuerdo con la siguiente dispositiva, podemos ver que la cantidad de trabajos tenían como 3 trabajos en los últimos años, y las semanas trabajadas en agricultura en ambos casos, tanto con casos como en control, eran como 30 semanas por año. Así es que estuvimos muy complacidos con este repaso estadístico. Como podemos ver, los grupos eran similar a lo que es el Estudio Nacional de Trabajadores del Campo, que tiene un gran historial a través de la nación y que típicamente es usado como una base de referencia. Ahora, yendo a la siguiente dispositiva, podemos ver que algunas de las características ocupacionales, podemos ver que la hipótesis que comenzó en el estudio es que el trabajar en medio ambiente más polvoso iba a ser asociado con el tener la fiebre del valle. Y podemos ver que hubieron como 5 niveles, pero al final llegamos con las conclusiones de que nunca, o a veces, o la mitad de veces o más. Podemos ver que un 71% del caso eligieron eso versus solamente 56 en los controles. Así es que en la mayoría de los casos nos decían que tenían más exposición a las situaciones de polvo. Y esto es simplemente la información cruda, como estamos mirando, basado a la evaluación. Y abajo, mirando el tipo de labores en el último año. Estos, prácticamente en estos pudo haber hecho todos estos trabajos la persona, si es que independientemente, tanto como en los controles, podemos ver que son muy similares. La diferencia que sí miramos es en la remoción de hoja. Esto nos deja ver que era más con más protegencia que en contra de la fiebre del valle. En la siguiente vamos a ver los cultivos, y podemos ver que las uvas eran el cultivo más frecuente. Como un 58% dijeron que trabajaban en la uva, y obviamente basado a los áreas, esto es un cultivo muy altamente encontrado en Kern County, en el condado de Kern. Y después las almendras, las mandarinas y las zanahorias, y también hubieron otros cultivos que estábamos mirando en prevalencia. entre el grupo, pero no los incluimos simplemente para ahorrar espacio. Lo que podemos ver aquí es que las uvas, el cultivo más de más tendencia, era lo que más altamente estaba siendo trabajado por los controles, diciendo que esto era un valor controlado, pero como podemos ver basado a las líneas, entonces empezamos a pensar en las zanahorias también, porque en este caso parecía parecer un riesgo que es más alta la frecuencia de casos que en los controles, pero estamos limitados por números bastante pequeños aquí, así es que estoy tratando de pensar biológicamente y de manera de mecanismo y podemos ver que podemos caracterizar los cultivos como algunos están cerca del suelo, como lo que son las uvas, los jitomates, todo lo que crece a unos cuantos pies del suelo. Y también podemos identificar los cultivos de árbol, como la almendra, los cítricos, y luego las verduras, como la zanahoria, el ajo. Hay algunos otros más que podemos identificar y pusimos esos en grupos para ver si podía haber una tira común en términos de las verduras y en sí vimos eso. Espero que podamos ver eso en la siguiente dispositiva, que sí hay una diferencia significativa. Ok. Y aquí
also looked at protective measures. So mask use at the last job, again, we dichotomized into never or sometimes versus half the time or more. And you can see that things are working in an expected or hopeful direction. That is, mask use is more common in the controls. High levels of mask use is more common in the controls, implying that it's a protection. And soil wetting when dusty at the last job also was more prominent in the controls, indicating that it was, protective. Unfortunately, yes, those levels were not statistically significant, nor is the magnitude of difference really very, very great. So the next thing that we did, if we go to the next slide, is that we adjusted the odds ratios for age and sex. Recall that in our initial demographic review there, we found that there were some differences between cases and controls on age and sex. So we wanted to be sure to look at odds ratios that were adjusted for those. And if we click, we will see that indeed for self-reported dust exposure, there was an increased adjusted odds ratio of 1.9. It was just barely significant, so the confidence interval there was 1.0 up to 3.5. Another click will show that those grouped root and bulb vegetable crops had an increase, had an odds ratio of 3.0, and that was clearly in the significant range. The confidence interval was from 1.2 to 7.1. In the next click, I'm going to show you what the two major individual crops were, because we talked about them earlier. Grapes, recall, we saw as protective in that they were more frequent amongst the controls, and the protective odds ratio there was 0.6 with a confidence interval of 0.3 to 1.0. For carrots, which is a substituent here of the root and bulb vegetable crops, it was about 2.9, and again, an odds ratio 1 to 8.6. Another click will bring us to leaf removal. Please recall that leaf removal seemed to be pretty protective, and indeed, the odds ratio is 0.4. So again, an odds ratio of less than 1 implies that something is protective. If it's greater than 1, it implies that something is a risk factor. So the confidence interval for that comfortably excludes 1.0. It's 0.2 to 0.8. So, and not quite statistically significant, of course, are mask use, which showed a protective odds ratio of 0.9, but not statistically significant, as we saw in the earlier analysis. And soil wetting in dusty conditions gave us a protective odds ratio of 0.8, which again is not significant. So that's not surprising.
Más no es muy significativo, así es que no nos sorprende, simplemente estamos incluyéndolo en el informe para ser más completos. Así es que ahora sí vamos a la siguiente diapositiva. Quiero hablar un poquito sobre qué significa la ciencia de este estudio. Este es uno de los primeros estudios que yo puedo identificar en términos de ciertas tareas donde las tareas podrían conferir más riesgo. Y si nos enfocamos en la población hispana en el condado de Kern, y realmente podemos ver que esto es un gran cambio en términos de coccidioidomycosis en todo el país. Así es que esto fue el exacto, preciso lugar para hacer ese tipo de estudio. En términos de la colección perspectiva de casos y controles, nosotros miramos los ejemplares por densidad y lo que es el uso de, del llamado al bias y
excuse me, of Hispanic farm workers is likely to receive their care at Kern Medical Center. It's the county medical center. So although there were some people who were covered by Kaiser, for example, and they would have been seen elsewhere and they might have gotten their laboratories studies done elsewhere, we captured the major part of the population that's at risk here by going to the public health lab and looking at people who came to us through Kern Medical Center. So this limits selection bias. And lastly, we have strength and plausibility of the findings. So an odds ratio of 3, for example, for the root and bulb vegetables, that's a substantial odds ratio. Again, risk is shown by an odds ratio above 1.0. So the higher the odds ratio, the greater likelihood is that there may be something causal behind it. It is also plausible. In particular, although with root and bulb vegetables, much of the harvesting is done by machine rather than people pulling it up, in fact, out in the field as they're packing it and working with it, they shake off the dirt, which will, raise clouds of dust. And that dirt is in the first foot or so of the soil, which is where coccidioides spores thrive. So there's a lot of, this makes sense, basically. So in terms of limitations here, however, let me rush to say that plausibility is a very thin reed on which to decide causality. In particular, there was no dose response. So I really would have liked to see that people who reported more work in dusty environments or more work with those root and bulb crops had yet higher risks for valley fever. So that's a dose response. That's a very powerful argument for causality, and that was not present here. So that's one issue we have to acknowledge. And also the crop findings require confirmation. This is really the first time that something like this has been looked at and presented. So I think it's going to be very important going forward that this work be furthered and confirmed. Other limitation is that sample size limited our power and detection of subgroup effects. I am pleased that we were able to get up to our promised level of 200 participants. It wasn't quite 100 of each, but it was close enough. And indeed, the power calculations that we went through to determine how many we need were borne out by the results that we found. So I'm not sure that ever happens, but it did here. So also, not all participants were referred for symptoms. In the ideal, you would have had someone going to Kern Medical with respiratory symptoms or symptoms suggestive of cocci, of valley fever, and the physician would have said, this could be valley fever, but I don't know. I'm going to have to test them to find out. And if it's negative, they're a control. If it's positive, they're a case. So everybody should have, in the ideal, been referred for testing because it was part of their diagnostic workup for symptoms. But in fact, at the Kern Medical Center, the OBGYN clinic screens all pregnant patients. So even though they weren't having respiratory problems, they were still referred. So, and they ended up being more likely in controls rather than cases. We did find some cases amongst them, but they were more likely to end up as controls. And I think that that is the reason that there's an age difference. Recall that the youngest group of patients were the women in the controls. And I think that that's probably why that is so. Now, in order to, get a sense of how robust our findings were, we did separate analysis after removing certain groups of patients. So we took, for example, all pregnant patients out and then reran the analysis. And of course, there were fewer people in it, so our confidence intervals got wider. But the basic findings that we saw in the entire study with everybody in it remained. Excuse me. We also did the same thing. We looked at men alone and women alone. And again, the findings that we saw were seen in comparable magnitudes in both groups. We also took out people who reported no symptoms because part of our questionnaire asked them about their symptoms for coccidioidomycosis. And after taking out people who had no symptoms, again, we saw the same finding in the remnant, although of course with wider confidence intervals because there were fewer people. So I think that the findings that we reported are relatively robust. Another issue is, did this represent old versus new infection? And again, ideally, if someone is referred for testing because they've got acute symptoms, we could have some confidence that it was a new infection, but some of them could have been old infections. Now, some of you will recall that the immunoglobulin tests were both for IgG, which is more commonly associated with old infections, and IgM, which is more commonly associated with new infections. But looking at those apart wasn't really helpful. So let me end here with specific aim number 3 for this study. So the first, again, was our survey of knowledge, attitudes, behavior, beliefs, and behaviors. The second was our case control study. And the third one, we wanted to see if we could find infectious spores in ambient air sampling. And unfortunately, we did not. The sampling was completed in Taft, California from October through December 2015. This was work done primarily by Keith Bine with Kent Pinkerton. Analyses were done by Jerry Last and Antje Lauer in CSU Bakersfield. And unfortunately, spores were not identified in any of those analyses. So the next steps, in my opinion, are, first off, we need to finish our manuscript for the survey, the knowledge survey. We need to work on developing educational programs that are informed by the study results. I think that there's further study of high-risk crops and tasks, because I think this finding of root and bulb risk is really interesting and should be followed up. Of course, I hope that there will be further work done on sampling of ambient or personal breathing zone air informed by results of the case control study. That is, we could go to tasks or areas and do sampling, personal air sampling, breathing zone sampling, to see if we can find airborne spores in the ambient air. And so I want to end with some special thanks to some very special people. My co-investigators, Kate Portillo Silva, Carol Sippen, Hee-Jung Bang, and Kurt Emery. I want to thank some of our UC Davis stars here, especially Demos Papagiannis and George Thompson, both of whom were helpful through the development of this study in providing me advice and help. I want to thank Royce Johnson, who's one of the star clinicians there at Kern Medical. He is a very well-known figure in the world of coccidioidomycosis. I'd like to thank the Kern County Department of Public Health Services, the California Department of Public Health. Again, they were helpful all along here in developing our survey instruments and talking over results and so forth. Of course, I want to thank NIOSH for sponsoring me through this study, for funding this study, and the center for providing a place where it could happen. Lastly, and most importantly, I want to thank California's Hispanic agricultural workers who bear this risk and participated with us to gain this new knowledge. So with that, I'll end and be happy to take questions, and thank you very much for your attention.
Wonderful. Thank you so much, Dr. McCurdy. As a reminder to everyone participating, please enter any questions that you have in the chat, and we will hopefully get through several. I know we have a few already. So I'm going to go ahead and fire away with them, Dr. McCurdy, and you can take as long or short as you feel appropriate.
Okay.
The first question refers to the increase in valley fever since 2013. Do you know why that is, why the rates have been increasing? And can you reflect on that?
It's not known. There are several factors that probably contribute to it. One, there's a population move into that area of people who are naive to coccidioidomycosis. Especially a lot of the farm workers coming in there, a large percentage of farm workers, seasonal and migrant farm workers, are actually doing it for the first time in their lives, or pretty close to it. So we've got a large population moving into there every year who are at risk for severe disease, Hispanics, as you recall. Secondly, it's an agricultural area, and I can imagine that there may be changes in agriculture that are resulting in more soil disruption and dust that could increase risk. Lastly, there is climate change. I mean, things have been getting hotter and drier. That is going to promote aerosolization and dust formation of the spores. So all those are, possible and actually, in my view, probable contributors to that. But I'm not aware of anybody who is, really looked at that in a very, granular way to identify it.
Great, thank you.
It wouldn't surprise me if some of our attendees here have further knowledge in that. So I certainly hope that they'll say something in the chat.
If they do, we'll be sure to bring it up. Speaking about the different commodities, you referred to carrots, and there's a question that I'm going to read. It says, as a row crop with high soil turnover, we have been told that valley fever is very rare in these situations and is more likely to occur in fields with limited soil turnover, such as vineyards and orchards. This does not seem to be the case with your study. Is that a fair assessment?
That's an excellent point. It's something that needs to be looked into. I don't have a definitive answer on that. I too have understood from experts in the field, I've not come across publications stating it, but that cocci spores are relatively rare in fields that are under agricultural cultivation. So, and for whatever reason that might be. It's something that needs to be looked into, but we did see this threefold increased risk associated with these crops. There is some biologic plausibility to it, but again, I can't, state definitively that it's causal. It really requires a further look-see and addressing that precise point that the audience member raises.
Great, thank you. Okay, here's a very timely question. Do you anticipate that cases will reduce, probably especially over 2020 and 2021, as farm workers are more encouraged to wear masks due to COVID-19?
I think that they will reduce, and I think they are reducing. Unfortunately, I didn't get a chance to look at the latest figures myself from 2020, but my understanding secondhand is that in fact they've gone down significantly in 2020. And I think that is likely due to the fact that people are having trouble finding work, basically. Mask use may help. I mean, the masks are imperfect, and bandanas in particular are imperfect, but they're probably better than nothing.
Great, thank you. How much of the increased risk among Blacks, Latinos, and Filipinos is due to their greater workplace exposure?
I don't have an answer to that, but certainly that is an issue.
Okay, thanks.
Certainly if we can look at the example of California prisons, so many of you are aware that in a couple of Southern California prisons, there's been an epidemic of cocci. And I would consider all those people in there, regardless of race, to have very similar workplace exposures, as it were. And indeed, people of Black ancestry, diabetics as well, were markedly at increased risk for cocci, and indeed they're no longer allowed in those prisons.
Okay.
So it's not all exposure. I think there are some genetic predispositions involved there.
Okay. Was there a noted increase in severity with comorbidities?
I can't, not that we looked at, and I'm not sure what the literature shows on that. Perhaps one of your audience members has deeper clinical knowledge on that than I do.
Okay, thanks. And then there's a question about weather patterns and their impact on potential exposure and the incidence of airborne spores, sort of in the wet seasons versus dry seasons transition.
Yeah. So weather has been brought up on many occasions, and one possibility is that if you have a rainy winter, it's going to promote growth of the fungus, then followed by a hot, dry summer. It makes it much easier to aerosolize. Again, I haven't seen this published, but I have it from secondhand from people I trust that I've talked to, is that they've looked at the weather patterns and not found a clear association between annual rainfall, for example, and subsequent numbers of cases of cocci in California. I don't know how deeply that's been done, but certainly we are in a major weather and climate change that could well make this a much more prominent disease than it's been in the past, because it's going to be hot and dry. That is going to promote dusting up of these spores.
Great. There's lots of questions, Dr. McCurdy. People are really fascinated with this topic. So thank you for allowing me to continue asking them.
Absolutely.
Another question, sort of in light of this study, what new questions would you add to your next case control study, if you were to do one?
I would like to, actually, I think what I would like to add to it would be biologic measurements, basically, because at this point it was strictly based on information we got from a questionnaire. It was supplemented by the laboratory testing. Granted, that's a biologic measurement, but it would be really nice to do some field studies where we're actually measuring exposure levels. And I would, that is airborne exposure levels, air sampling. I would like to do something like that in some of these hotspot crops, such as carrots and other root and bulb vegetables.
Great. Okay, here's one about the ambient air sampling. So they're interested in the cutoff. So did you use a 10 micron cutoff? I'm assuming these virus particles, and they're, I believe, fungal, are 10 to 20 microns in size. And then and sort of associated with that, the visibility of sort of the use of masks because of COVID, and whether or not that could help in prevention.
Yeah, that's an important question. Unfortunately, I wasn't involved in that particular data collection and so forth. I don't know if Kent Peterson is on or Keith Bine. They're actually the ones who did that. They might be able to address that. I would guess that they did it in a proper and scholarly way that took into account all those important factors.
Absolutely. Okay, thank you. A couple comments that have come in that I'll just put out for the group. One says that the spike in numbers starting in 2011 coincides with the last drought. This may be an area of possible investigation. And another comment is that Kern County has some of the lowest wind speeds in the state. So they would bet it would depend on wind in combination with precipitation history.
I would guess that's true. I was not aware that they had the lowest wind speeds in the state.
Right. And we did get confirmation from Dr. Pinkerton that they used a 10 micron cutoff size.
Okay, great.
Thank you, Kent. Okay, I'm doing a scan, and I think I managed to ask you every question that we received.
Okay.
It's possible that one will come in the next moment, but while we wait, I want to remind everyone that this is a monthly seminar series, and I encourage you to register for our next seminar. It will actually be held in February. We'll take the first Monday of January off. I also want to express sincere thanks to Dr. McCurdy and then also to Reina, our interpreter. We're really pleased to be able to be offering these seminars both in English and Spanish. And so please spread the word. This is going to be a regular occurrence. So I think I saw one more question, and it might, oh, this is another one probably for Kent. So if you're able to jump in, Kent, what kind of air samplers did you use in Kern? And then another question while we wait for that response. Steve, how did you determine if individuals in the case control study contracted valley fever at work versus in another community setting?
We could not do that. And indeed, that was one of my fears with this, is that we might not find anything because it may well be that the major exposure is simply being outdoors, right, rather than anything else. So there really was no way to do that. That's one reason why I think doing on-site sampling, air sampling as part of a study would be helpful.
Wonderful. And Dr. Pinkerton replied that they used high volume samplers, HI high. And with that, I think that we will end for today. So thank you again, Dr. McCurdy. We really appreciate you coming back from your retirement to present your important research to us. And I encourage everyone to join us again in February for our next seminar. Thank you and have a great afternoon.